Thank you to Amira, to Khalid, to the team at Sidra for inviting me to share my daughter Mila's story. In many ways, a story that has led us to where we are today in precision medicine for genetics. And before I tell you any more, I want to share a very short video with you. It's my only way of introducing my daughter to you before I tell you more about her story.
You make me happy when skies are gray.
So our daughter's name is Mila Virginia Makovets. She was born on November 5th, 2010. When I think about Mila as an infant, I think about smiles and laughter and health and...
Half an hour after she was born, she was strong enough to hold on to my finger and I could almost pick her up off the bed.
When Mila was a toddler, she was a climber, she was a hiker, she was a runner.
How old are you, Mila? Here's our sugar high daughter.
Slide, slide, slide.
Very physical, always loved to ride a strider.
Nice, bud.
Play in the snow, or go sledding.
Coming!
We noticed that Mila was getting stuck on her words. She would say, "Mommy, Mommy, I have to. Mommy, I have to," and not be able to continue. And then suddenly, around 3 years old, we started noticing that her feet were slightly unturned and she was walking strangely. And then at 4 years old, we noticed that she pulled books in close. And then around 5 years old, Mila's feet started moving really quickly in this strange pit-pattering way, and then she would fall back on her butt. And every time she stood up, she would fall back and stand up and fall back. You know, we took her around to different doctors who never could really kind of figure out what was going on with her. And then time passes, and then in just 1 month, everything can change. She could no longer see anything. What's brought her so much happiness is playing with her toys and or looking at her books and watching TV and playing with her brother, and suddenly it looked like she could no longer play with anything. It's so hard to see such a outgoing little girl not be able to play with other kids and not be able to play with toys and not be able to watch Elmo anymore.
As you could see, my life started like many people's lives. My daughter was perfectly healthy. I live in Colorado in the United States. My daughter was, at 2 years old, was hiking for hours. She was skiing from the top of the mountain. She was riding her bikes and singing songs like all other kids. She had no medical problems until 3.5 or 4 years old, when she started having one problem after the next. I brought her to 100 doctor's appointments and therapy appointments around the United States, into Canada, and I was told that I was a crazy mom and that she would grow out of all the symptoms. But she was pulling books in close to her face. She was tripping and falling. She was covered in bruises. She was stuttering and getting stuck on her words. And she continued to have one neurological problem after the next. I carried a little piece of paper around with me to doctors that said neurological symptoms with a question mark. And every month I started adding more and more problems to that piece of paper. After 2.5 years, when she was 6, I gave up. I went to the emergency room, and my daughter was diagnosed after genetic sequencing with a rare form of a already very rare condition called Batten disease. I was told in just 1 minute that my previously healthy daughter was going to lose all of her abilities except for hearing, and she was going to die in the next few years, and that no child had ever survived this condition. I thought that I was a pretty well-read person. I had no idea that a typical child could degenerate as if they were 100 years old, and she was only 6. In many ways, my life, as I knew it, ended that day. I turned 40 a few weeks before, and I see my life in 2 halves. One is before I learned that my child was going to die, and then afterwards. I started reading every white paper, medical journal, which I didn't understand, articles, until I learned as much as I possibly could about Batten disease and other genetic conditions that were similar. And I started speaking with scientists and doctors around the world. I learned very quickly at that time, which was the end of 2016, that there was a small glimmer of hope that maybe I could stop my daughter's disease, but it was very small. That's all I needed. I started a nonprofit foundation. I started telling Mila's story to anyone and everyone. And somehow, I don't know how, I raised millions of dollars over the course of that year as my daughter was rapidly declining, losing her vision completely, losing her last words, and saying "mommy" for the last time. And I was very, very fortunate to meet Dr. Timothy Yu from Boston Children's Hospital. Mila had been diagnosed with Batten disease, but it requires 2 mutations, and they could only find 1. I reached out on social media in a desperate plea to have someone help me with whole genome sequencing, which was my only chance to be able to get a full diagnosis for my daughter, and very importantly, to test my little 2-year-old son, who could not be tested until we had both mutations. Dr. Yu from Boston Children's raced against time with me over a course of a year, first to find Mila's missing mutation, and then afterwards to work with his incredible lab to be able to come up with the possibility of a treatment that was based on her very unique mutation within her disease. Around that same time, Spinraza, which was a life-changing medicine for spinal muscular atrophy, another terrible disease in small children, had just been approved by the FDA. It was on everyone's mind. And Mila's mutation looked like it was amenable to the same approach. The problem was she was the only person in the world who had this mutation within her disease. So as you can imagine, many people said to Dr. Yu and his team, "That's crazy. How can you make a medicine for one person?" I was very, very fortunate that he and his team said, "But she's dying. And we have designed a medicine that's looking like it's actually restoring health to her cells in the lab." So he pushed forward, and he and his team, over the course of that next year, designed a medicine for Mila that was named after her called Milacin. We moved from Colorado to Boston, and Mila began receiving a medicine. We did not realize at that time, or I would say better, the goal was to try to save my daughter and try to turn that into a way to help others. But we did not quite set out for this to become the very first medicine in the world for one person. My daughter did incredibly well for the first year. Her 30 seizures at that point a day went down to almost nothing. She sat up better. She had been very slumped. She had stopped eating by mouth and had a G-tube. She started eating by mouth again. It was pureed foods. It wasn't perfect, but it was a great increase in her quality of life. She started laughing and smiling at the songs and the books that she used to laugh at, and had stopped doing that right before receiving her treatment. Unfortunately, 3 years into her treatment, I saw that Mila's disease was progressing. This is something we knew could happen as we're finding children like my daughter too late. I was faced with decisions that no parent should ever have to face. And think about what your child who cannot see, cannot speak, cannot take a fly off of their nose by themselves, about whether or not they would want to continue living. And when my daughter was 10 years old, she died. And I'm forced to get up every morning and live life without her. I am a very positive person. I have an incredible family and friends, and it's still unbearable. I do not know how anyone, any parent, outlives their child. Unfortunately, Mila's story is not unique. There are millions and millions of families and children like me out there. I didn't know this before I entered this world. And the reason that I'm still here today and why I've been pushing for individualized medicines like my daughter's to become a routine way of treating disease is because while this was not in time for my daughter, it showed what's possible, right? That we have the technology today to be able to find the root cause of a disease and to be able to design a medicine to target it, even if it's unique to one person or just a few. What I've learned along the way, thanks to Dr. Yu, who will be speaking in just a few hours, what I've learned over the thousands of conversations in the last 9 years is that our system of delivering medicines was designed for population medicine. But the problem is that with genetic medicines, I don't pretend to be experts like all of you, but only a few dozen of those are large, and they fit through the current system of large clinical trials that take many years. The problem is that genetic disease by nature are very small. We have a few dozen that are common. We have 10 to 15,000 diseases that are small or rare. I like to say small. I think rare sort of takes us down the wrong pathway. Genetic diseases are small, and now we are finding the underlying root cause, which is often a single mutation, like in Mila's case, and that is further regrouping patients into smaller and smaller groups, sometimes just one. So science isn't the limiting factor anymore. We couldn't find children like my daughter before, and we certainly could not design treatments for them, but now we can. This isn't a science problem anymore, it's a human problem. It means it's a moral imperative for all of us to change the system of access. That means specifically starting with the regulatory path and also the payment or reimbursement. That's how patients access medicines. In many ways, I mentioned before, I live in Colorado in the United States, not too far away from the Grand Canyon. And in my mind, the Grand Canyon, this abyss, is what exists between the millions of just children that are dying alone. Just, dying children. We're talking about millions of Milas on one side of that canyon. On the other side of that canyon is the booming technology that many of you experts in this room are working on. Incredible therapeutic modalities, delivery mechanisms, but unfortunately the only way to access that is a big bridge across this abyss that is for large populations, population medicine. But what about the other, hundreds of 200 million estimated children that have small genetic diseases? They can't go over that bridge. They can't do a 10-year clinical trial that costs billions of dollars. The only other option is one that I took with Dr. Yu, which is a very small little tiny bridge that's for sort of a compassionate use or research. And only a few dozen children in the last 8 years have been able to access that like we have, despite the fact that there are tens of thousands at least that are amenable to the same technology that Mila's medicine was based on. So I think at this point, we all have to face the fact that the way that we have delivered medicines does not work in this new era. The status quo is not working. The way to understand that is to see how many children who are dying have been treated. That's the metric. There have been 75 children in the world that have received an individualized ASO. More recently this year, you may have heard of baby KJ, who, following Amila's path, received the first CRISPR medicine. But there's tens of thousands that could be amenable just to this one technology, and as soon as you expand to gene editing and other technologies, we're talking about soon, eventually, millions. So how do we bridge that gap? I think the clear answer is that we can no longer look at one single medicine and look at every step of the way for every medicine one at a time. It's never going to work. You can do the math. There's 15,000 diseases now being further categorized. That points to a future of thousands of medicines that are highly precise and likely more effective. So we have to change the system. I think that there's a great opportunity here in Qatar to be able to lead the world in this. This depends on starting with regulation. Can we think about the product as a process? It means instead of going one product or therapeutic at a time, thinking about how to approve a process so that whether it's an academic center, a hospital like Sidra, or whether it's a company like Everyone Medicines that I started so that parents didn't have to sell cookies and raise millions of dollars, how could either a company or an academic come with different patients, all dying children across different diseases, different mutations, but keeping the same process, the same technology and science, the same route of administration, do it over and over again in a repeatable fashion to prove that that process can be approved. So they can continue to come back with more dying children without having to go through an enormously long process that is not fit for individualized medicines. So I think if this is changed and there is payment, it will incentivize companies to work with hospitals and be able to do this at scale so we can help solve what I think is a global health crisis. I'm not sure why other people are not calling it this, but when it comes to 200 million dying children, I don't know what it is. So I encourage everyone here to start to think about access to medicines in a different way in this new era of individualized medicines. And if we do that, then I really believe we can get from Mila to millions. Thank you.